It is 113 days in the fight against COVID-19 in Nigeria. Medical experts have reacted to the recent spike in the number of cases, saying that the country is still far from flattening the curve. Level of adherence to safety measures is daily dropping as many no longer use face masks or practice physical distancing. Now, the ban on interstate travel is constantly being flouted as persons travel from place to place with ease, causing a spike in figures with the highest since the outbreak recorded today or in the last 24 hours. Joining me now on Skype is Julie Mobo, Executive Director, Royal Nursing Consults. All right, it's good to have you join me, Julie. Nice to see you. Now, when it comes to flattening the curve, it is what everyone is looking forward to. But if you recall, WHO and international agencies have all warned initially that the numbers might be worse off in sub-Saharan African countries, and Nigeria is inclusive. From what you're saying now, the spike in the numbers, is that where we're headed?
Thank you very much, Mike. I think we're headed in that direction. Some people are under the illusion that we have already peaked the surge, but honestly, we're just getting to that peak. We're just getting there, and that is what we're currently seeing, because the level of adherence to the rules and the measures and regulations is quite low and quite discouraging, I must say. And people should be aware of the fact that we are yet to peak that that phase. We are yet to get to that phase where we say, okay, this is where we have gotten to. Now is the time to start going down the slide and look forward to flattening this curve. That's where we are headed.
All right. Now, as we are right now, what is the biggest challenge right now causing this spike? A lot of people have advised or even suggested that government should begin to consider imposing fresh restriction of movement in certain cities, especially like in Lagos and Abuja, that usually record the highest numbers.
I know that there's a need for certain measures. And to answer the question directly, Mike, what is the greatest challenge? The fundamental issue here is our belief system. Sadly, even some elites, those you would least expect, still think that coronavirus pandemic is a scam. So people are still asking, even up until yesterday, someone still asked, is this real? So if we have people questioning the authenticity of all that has been happening all over the world, then we have huge problems in our hands, because what we believe will translate into how we behave. So the zero or low level of compliance to restrictions, to regulations of physical distancing and all that, we are not surprised, because many people still don't believe that this exists. Now, a few other people are beginning to take this seriously because of the people that are sadly dying from this. Now, they are not far anymore. It's not in China, it's not in the US or UK, it's not even just in Nigeria. It's coming closer to voices they have heard, people they have seen. And all of a sudden, you're not seeing them anymore. And it's as a result of this. That's number one, the belief system. Secondly, there has to be something about awareness. In order to tackle that, there has to be some form of rigorous activities centered around creating an awareness that this is not just real, that it stands the chance of wiping off a whole generation. If people check back to history, this is not the first time we're experiencing something like this. We lost hundreds of thousands of lives. The US, the United Kingdom, they are there. China, there are other countries that have lost so many people, and they keep losing people on a daily basis. So there has to be some form of awareness. Another challenge that we have on our hands is that there are many people walking on the street with underlying medical conditions. Some of them aren't aware. Some are scared. They are beginning to be aware, but they are scared of going to the hospitals to receive care. Something has to be done about that. So these are some of the challenges that we're facing.
All right. Now, some medical unions are calling for strike due to welfare-related issues and exposure to hazards here and there. Now, how will this compound this situation? Because the doctors are like the soldiers, the white soldiers in the front line. And if they go on strike, doctors and nurses, then I wonder if media people or engineers will be the one to salvage the situation. Talk to us about this.
I think it was Nelson Mandela that said that our spirit is revealed in the way we treat our citizens. So now citizens in this context, we're talking about the medical professionals, the healthcare practitioners. So how are we treating them? It shows our spirit as a nation. If they are crying for help, then the government should listen. If the government is handicapped and cannot help, there's a way that will be communicated. Actions must follow words. Words aren't enough this time around. We don't need words this time around. We need actions. It's going to compound the problem. And if the medical, I know that the action they're embarking on is for the good of the entire healthcare system. But if they go on strike, the nurses might follow. What if the lab scientists follow? Because it's going to compound. Already our healthcare system was weak before COVID-19. COVID-19 came and exposed our weaknesses. We have been trying to salvage the situation, and they're becoming overwhelmed because they're lacking bed spaces and they're lacking sufficient manpower to manage the situation. And now a whole group of healthcare practitioners want to go on strike. It's going to, we don't even want to go there. I think the government should take this very seriously, because look at the people. You don't expect them to go to work unsure of what is going to happen. Right. We need our healthcare practitioners to be in the best frame of mind. Some of them I know have had to rent a different apartment. So when they're asking for this allowance, they're not asking for it to be able to take a fizzy drink or something, or to go on a walk in a ride in the park. Some have had to rent a separate apartment so they don't go back home to their families.
Back to their families, exactly.
Yes.
All right, we have to leave you here now. Thank you very much, Julie Mobo, Executive Director, Royal Nursing Consults. We really appreciate you for your time.